Hi, thank you for stopping by. My name is Monica, and this presentation will include education about LGBTQ patients and what should you do in the emergency room. In the US, there's an increasing awareness in the need of culturally sensitiveness to reduce LGBTQ health disparities. Awareness will include the need of workforce for inclusiveness and that the LGBTQ population have unique needs and they often experience health disparity when compared to other individuals. Identifying the main problem will help us change and improve care. Lack of awareness among healthcare workers, limited education on LGBTQ health topics, poor patient-provider communication, and discrimination in healthcare all contribute to the health disparity in the LGBTQ population.
Now, let's talk about what has been done so far for the LGBTQ rights. In 2010, Section 1557 of U.S. Affordable Care Act prohibited federally funded healthcare providers from sex discrimination. In 2016, the Obama administration issued a rule clarifying that Section 1557 prohibits discrimination against transgender individuals. However, in June of 2020, the U.S. Department of Health and Human Services under the Trump administration issued a new rule which rolled back these protections. Later, in June of 2020, the U.S. Supreme Court held that LGBTQ discrimination is sex discrimination under the Civil Rights Act of 1964, thus Federal Workplace Protection, Title VII. Although discrimination against individuals of the LGBTQ community is illegal, education about how to provide proper care is still lacking. In 2015, qualitative study of 268 practicing nurses revealed that 80% had no education or professional training on LGBTQ health issues. Thus, lack of awareness limits the ability to offer optimal care within this population. The poor patient-provider communication can affect the patient's experience and their choice of accessing needed health care in the future. When sexual orientation and gender identity are not discussed freely, health conditions that are overrepresented in this population may not be appropriately addressed. Education the next generation of healthcare providers across health professionals is important to provide the LGBTQ inclusive healthcare. Since we are still in the middle of a pandemic, a wide variety of online education about the LGBTQ community is available asynchronous. Online is a feasible method for delivering education on LGBTQ healthcare and disparities to interprofessional students during professional training. Discussion threads prompts were successful in stimulating a conversation focused on patient experience of care. The impact of the odd experience on care outcomes at both the individual and the population levels improves short-term knowledge of this minority population and addresses healthcare disparities and practice. Education is the first step for healthcare workers to know the law of discrimination and guide them towards a change in conduct. LGBTQ patients report facing discrimination, such as disrespectful comments, delay of care, or outright refusal of care in healthcare settings. In 2018, 29% of transgender patients said they had been turned away by a medical provider due to their actual or perceived gender identity. Lack of cultural competency as well as discriminatory behavior by healthcare professionals, including derogatory comments, results in patients avoiding subsequent clinical encounters and resort to online searches to find healthcare advice. Nurses are known to be the strongest advocate for patients' rights and assure dignity in care. Here are some steps nurses can take to protect this minority group. Intervene or report verbal insults or derogatory comments against LGBTQ patients. Advocate for electronic health system for inclusive nomenclature or preferred nouns. Look for resources such as the Institute of Medicine Committee on Quality of Healthcare in America, which has called for more focus on interprofessional teams to improve patient care specific to serving the LGBTQ community. suggest interprofessional education, IPE, training, where learners can share their experience with each other. Interprofessional online education supports the emerging culturally sensitive healthcare force. Awareness in these topics are more likely to demonstrate positivity and respect towards minority groups, and healthcare professionals work together to improve patient outcome. The aim is to improve the service to the LGBTQ community and ultimately reduce health disparity among this population. Incorporation of learned material into daily practice and to work collaboratively across the continuum of care to provide a welcoming environment for this minority population will decrease patients' hesitation to seek care, secondary to judgmental affections from healthcare workers. In 2017, within January and April, 489 LGBTQ adults were surveyed from a national probability-based telephone survey. The following are common interpersonal discrimination reported by the LGBTQ adults. Aggression included 57% being racial slurs, 53% being microaggressions, 51% being sexual harassment, 51% being violence, and 34% harassment regarding bathroom use. More than 1 in every 6 LGBTQ adults also reported avoiding health care due to anticipated discrimination, and 16% of LGBTQ adults reported discrimination in health care encounters. We are still a long way to reduce discrimination against LGBTQ adults. The 2017 statistic illustrates the need for changes in institution policies and practice to protect the civil rights of LGBTQ people. Education and inclusiveness are the best tools to confront stigma and counteract harmful effects of discrimination and interpersonal interaction. Voicing against institutional and interpersonal discrimination are vital to the improving and ensuring the health and well-being of LGBTQ Americans.
Thank you for watching this presentation.